Hello, hi, I'm Philip Charlesworth. I'm a consultant urological surgeon. I'm based in Berkshire and in London, Reading, Windsor, Cromwell Hospital and Harley Street Clinic. I started specialising in urology in 2003. I was drawn to the fact it's got a wide range of expertise in skill-based urology and diagnostics and in treatment. I've always had a fascination in treating cancers. I find that really rewarding to help people through a very difficult, challenging part of their life, and particularly if we can remove and successfully treat and cure cancer, that's fantastically rewarding from a personal point of view, and it's great to be involved with people's lives when they go through that. And urology offers lots of that. And my area of expertise is particularly cancers within the pelvis, to do with prostate cancer and to do with bladder cancer. And I've evolved into an area of surgery which is rapidly evolving, which is robotics, with utilizing the latest technology to really optimize cancer outcomes, but also manage to get patients' lives back to the fullest they can be, with the minimum of complications and kind of negative outcomes from their cancer treatments, which is fantastic. The thing I find most rewarding about urology and urology cancers is being part of the journey with the patient, from the initial concerns that they might have cancer, through the difficulties of the diagnostic phase of either proving or disproving that they have cancer, which is very satisfying to tell patients that their tests are clear and they don't have cancer. But if they do, then helping them through that process, and then planning treatment and being honest and transparent about what it looks like, what the downsides are, and what the balance of treatments, and finding the best treatment that suits them. And then ultimately getting the patient out the other side, and getting the patient back to full capacity, back to work, back to sport, back to activities, things that they enjoy doing, and helping optimize their recovery and speed up their recovery. It's very enjoyable. What do my patients value most about me? Probably a sense of humor. It's always a difficult time when you go through complex surgery and cancer diagnosis and things, and certainly the area of the body where I specialize in, the pelvis. I think it's approaching things with a smile and try to relax the patients as much as possible is always something I try to do, and I think a lot of the feedback I get from the patients is usually quite positive, that it just relaxes them a little bit and helps them through difficult times. A mantra or catchphrase that I use in work. I do like the idea of accumulation of marginal gains, which is something that's used a lot in professional sport and is increasingly used in complex surgery. And the type of kind of high-end complex robotic surgery I do, it's really critical. And the principle being that if you want to try to get 10% better, i.e. 10% better in cancer outcomes, or a decrease in complications, or improvement in functional or return to full functionality, if you want to get 10% better, you don't necessarily look for one thing that is 10% better, but you look for 10 things that are 1% better, or 100 things that are 0.1% better. And because all these things add up, so from the team that you work with to the technology that you use, and the adopting of modern approaches, and the finessing of every tiny little step associated with complex surgery, it all adds up, and that all adds up to be a better outcome from, as I said, cancer or functional outcomes, which is really what kind of drives me on.